In this video, I'm going to define metabolic syndrome, the symptoms that we get in correlation with metabolic syndrome, and then give solutions to reversing those symptoms and losing fat. First, if you like this video, make sure you give it a thumbs up and subscribe to my channel for more educational content on how to be healthy and reverse, or even better, prevent disease. We'll get into it. So metabolic syndrome is fat storage. It is when cells that aren't supposed to store fat are storing fat. There are parts of our body that are actually designed to store fat. Those areas are our hip and butt area and our stomach area. The name for this fat is subcutaneous fat and visceral fat. We need healthy levels of subcutaneous fat to have a strong immune system and balanced hormones. Metabolic syndrome, or bad fat storage, is when cells in the liver and muscle store ectopic fat as a result of insulin resistance. When fat is stored in organs, it's harder for those organs to do their job, resulting in what we experience as a symptom and eventually a diagnosis. These symptoms are as follows: joint pain and fibromyalgia, infertility and irregular menstrual cycles, or painful PMS symptoms in correlation with menstrual cycle, chronic fatigue, fat gain in the belly area, which is called visceral fat, mental health issues, so depression and anxiety, bloating after meals, irregular bowel movements, weakness and or loss of skeletal muscle, and skin tags, rosacea, rashes, all of this due to allergies. Weight gain occurs as a result of insulin resistance, which means we want to fix that first, and then the fat loss will happen gradually. The way to reverse insulin resistance is to control insulin so that ectopic fat doesn't get stored. Right now, 70% of healthcare costs are because of metabolic syndrome, aka ectopic fat in the liver and the muscle. Type 2 diabetes, PCOS, cancer, and fatty liver, these are all a result of ectopic fat. The solution is almost completely dietary. A super helpful way to think about food is, in order to lose fat, we need to feed the gut and protect the liver. When I was in my early 20s, I was working out 6 times a week. I was training clients in a gym full time. All my friends and family were pretty healthy, and for the most part, I was a pretty emotionally stable person. The only part of the puzzle I was missing was diet. So I was eating a vegetarian diet from age 17 to 21, and it was mostly, honestly, like bread, beans, protein powder, Greek yogurt, which are all, not all, but mostly highly processed foods with emulsifiers, seed oils, artificial sweeteners, lectins, all of that stuff. So I started to develop autoimmune issues. I was never fat, but I was never lean either, which was frustrating because I always felt like I was way more sensitive to food than the female personal trainers I was around. So I would eat processed food, get joint pain, take some time off from lifting, gain some fat, and just kind of repeat that cycle until my body fat made me just not really feel great. Long story short, I ended up in the hospital because my joint pain got so bad that I couldn't walk. And that was a wake-up call. After that, I stopped all pain medication, antibiotics, and birth control, and I started filling the gaps of nutrient deficiencies in my diet. Once I cycled off all the garbage I was eating, my body had a much easier time losing fat and my health improved. That time of my life taught me that food can make or break your health. I was working out 6 times a week, getting more than 10,000 steps, and I had healthy relationships for the most part, but the food was not dialed in because I just did not know how to do that. As a result, I spent 9 hours in a hospital, and I just confused a bunch of doctors and got prescribed more pain medication. That's my story. Now let's break down the sequence of events in your life that could be the cause of fat storage. In a healthy human, you eat, food gets broken down into energy or ATP, and that ATP is used by your body as fuel. In metabolic syndrome, you eat, food gets broken down, and then the glucose from that food can't get into the cells to be used for energy, so it ends up getting stored as fat in the organs where it does not belong, causing a traffic jam in the blood. The reason why the glucose can't get into your cells is because your cells are resistant to a hormone called insulin, which is where the term insulin resistance comes from. This also increases cardiovascular risk because of the traffic jam happening in the blood. All you need to know about this process is that if you feel like garbage most of the time, you likely have a traffic jam going on inside your body. The way to get the traffic jam moving again is through the food you eat, or in other words, your diet. Let's talk about relationship with diet. This is something that I talk about a lot because I work with women and women are emotional. I know because I am one. So in life, you have a relationship with everyone and everything. If that relationship is based on respect, no issues. If that relationship is based on manipulation, coercion, and desperation, that's an issue. Food is arguably one of the most important relationships in your life because most of us eat 3 times a day. So food is constantly around physically, and we are constantly thinking about it mentally. So it's in our thoughts and our environment every single day. When you have an unhealthy relationship with a person who's around you all the time, it's pretty awful. When you have an unhealthy relationship with food, which is also around you all the time, it's equally awful. In the same way that we would address relationship issues with a human, we should address relationship issues with food. And the best way to do that is by paying attention to how food makes us feel whenever we eat it. I got to a point where straying from my diet caused so much pain and discomfort that I stopped seeing my way of eating as restrictive and started seeing it as a form of self-respect. Back to my explanation of what metabolic syndrome is. We talked about how metabolic syndrome and bad fat storage are the same thing. We also talked about the symptoms your body gives if you are storing fat in the wrong places. If you go to the doctor for this issue, they will suggest weight loss drugs, which are likely to cause more long-term disease risk. And if you're interested in that topic, you can go to the video I made about Ozempic, which I will link below. The exact dietary approach I would take to reversing bad fat storage can be broken down into 2 categories. The category you fall into depends on your activity level. If I have a client who sits for work and has less than 6 months of gym experience, they would fall into a low activity category. If I have a client who moves around for work, so a waitress, a tradeswoman, or a stay-at-home mom, and they have exercise experience, they would fall into a medium to high activity category. The reason why this matters is because however much energy your body uses in a day will tell me approximately how many calories you should be eating and how many of those calories should be given to carbohydrates. For those who are low activity, I will do a high fat, high protein approach. For those who are highly active, I will do a balanced approach. For example, I started working with a client who has non-alcoholic fatty liver disease. She is a medium to high activity level, so I calculated her caloric needs and put her in a slight deficit, which for her is 1,800 calories. Her protein is 40% of her diet, or 180 grams per day. Her fat is 30%, or 60 grams, and her carbs are 30%, or 135 grams. All my clients eat a pretty high protein diet, but the thing that fluctuates is the carbs. So if I had the exact same client, but all she was doing was working a desk job and going for walks, her carbs would be more like 60 grams per day instead of 135. So slightly more fat and fewer carbs, but the protein would stay the same. So the macro percentage for carbs at a high activity level is 30%, and the carbs for a low activity level would be more like 10 to 15%. If you want to learn how to calculate your own calories and macros, I'll put it in the description, and you can also click the link for access to my ebook, which is free, where I teach all of this. And it's literally that easy. If you have unwanted fat storage, aka metabolic syndrome, the dietary approach is always high protein and limiting carb intake based on exercise. I did not go into much detail on the quality of these carbohydrates, but just remember that any carbohydrate you ingest should have fiber. That's a good way of feeding the gut and protecting the liver. To go back to myself as an example, the diet that I was eating when I was having all my symptoms was very high in processed carbohydrates. And although I was working out 6 times a week, I was constantly dealing with joint pain. So I would need to take weeks off where I was just walking, but I was still eating as if I was doing intense resistance training during those weeks off. So if I was coaching that past version of me, I would tell her to stop eating processed carbs like bread and eat more fruits and vegetables. And that alone probably would have helped with fat loss and joint pain. The reason why I had joint pain was a combination of issues with blood flow from insulin resistance and an increased immune response from my gut from the refined carbohydrates. So that is my breakdown of a simple, hopefully, definition of metabolic syndrome, which is bad fat storage. Thank you for watching, and if you like this video, give it a thumbs up and let me know in the comments if you have an experience similar to mine, because I would love to know. If you like this video and you want to see more, then subscribe and click the bell. Until then, remember that your symptoms are common but not normal, and you have the power to change.